A new treatment for COVID-19 is helping patients recover faster and avoid longer hospital stays. That is crucial because hospital beds are filling up with COVID patients. Grace White talks to one woman who says she was one of the first people in Houston to get the treatment and has since recovered.
Excruciating headache. Started in my ear. I thought I had an earache.
That's how the COVID symptoms started for Zandy Zilov. As a retired nurse, she thought she'd be fine, but then noticed her oxygen levels dropping.
I exercise a lot. I walk a lot. That's my exercise. And so my oxygen is usually pretty high, but it was trending down, and that was scary.
That's why she turned to Houston Methodist for the monoclonal antibodies treatment and says it was fast, less than 3 hours.
What did it feel like?
It's so easy. It's like having an IV or easier than having your blood drawn, really.
I think the key is that you have to get it early.
Dr. Howard Huang with Houston Methodist says you need the antibodies within 10 days of starting symptoms. It made headlines when President Trump received a similar treatment, but has since been criticized nationally for not being used. Houston Methodist says they've given it to 850 patients and are still trying to get the word out to people who may not have heard it's an option.
These antibodies have been shown in clinical trials to reduce the viral load quicker than if somebody were to recover from the infection themselves.
For Zilov, she felt better the next day and is convinced the antibodies helped her avoid being hospitalized.
By getting it, you're potentially helping other people because you're freeing up a hospital bed.
You can still get the vaccine. Doctors just want you to wait 90 days because you are COVID positive and receiving antibodies when you get this treatment. Houston Methodist says it is something insurance is covering.